A hand function test presented by second year students, Department of Occupational Therapy, Bangladesh Health Professions Institute. Area of assessment: functional mobility, transferring object. Patient condition is a stroke patient. During this process, patient will sit on a chair, foot placed on the footrest and the hands on the lap. Tools: a bag, one pencil, zipper, key with lock, a glass, scissor and buttons. Test including in this video: hook grip, light pinch, heavy pinch, lateral pinch, light grip, heavy grip and opposition. Score: 0 for impossible, 1 for much assistance, 2 for little assistance, 3 can manage with minimal difficulty, 4 for normal. Hi, this is Jannatun, an occupational therapy student from Bangladesh Health Professions Institute. In the current era, stroke being a leading cause of death. After getting discharged from hospital, stroke survivors may face some form of physical disability and they may require assistance to use their hands in their daily life. In this video, we are going to show you how an occupational therapist assesses hand function for a stroke patient. Before you start, you need to make the patient feel comfortable with you. And don't forget to sanitize your hand before you start the process. At first, therapist will describe about the assessment process and will make sure that patient agreed in this process. After that, patient will permit with his written consent. Here, the therapist talk with the patient about his condition of stroke and if the patient are facing any difficulties to perform his activities of daily living by using his hand. Therapist will demonstrate first, then instruct the patient to carry a bag by making a hook grip and hold for a few seconds. Therapist will provide a pencil and instruct the patient to pick up the pencil from the table and then hand over it to the therapist. Then, the therapist will instruct the patient to put the key into the lock by using his affected hand and turn it 90 degrees. Then, the therapist will check the quality of lateral pinch. To assess light grip, the patient has provided a lightweight empty glass to hold and carry it to the mouth. If the patient can perform, the therapist will consider it as normal and then put the glass back on the table. Patient will hold the water-filled glass and try to bring it to his mouth. If needed, therapist will assist the patient to grip the glass and perform the activity. Patient will hold a scissor with his affected hand and the therapist will check patient's finger opposition. Therapist will engage the patient in buttoning by providing a multitasking object. If needed, therapist will assist the patient and look how he performs.
The purpose of hand function assessment is to measure the ability and quality of hand while performing an activities of daily life. A functional hand assessment determines functional ability, that is how the patient use his hand in spite of present disability. After the evaluation of hand function assessment, therapist can identify patient's impaired hand and work on minimizing functional limitations.